Most common problem in day-to-day gynecology practice is to address the issue of heavy periods. In medical terms, it's called menorrhagia. Now, as you are aware, lot of women, they need removal of uterus for some reason or other. The medical statistics says that 65% of these operations are done only due to abnormal bleeding or heavy bleeding. So what is the reason behind it? How do we define what is a heavy bleeding? Now the medical science says more than 80 ml of bleeding in a cycle, in a day, is a heavy period. Now it's very difficult to measure the bleeding. So basically we have to go by the woman's say. If her social life, working life is getting disturbed by the bleeding. So if somebody is complaining of heavy period, then we try to evaluate the situation first. Considering her age, her parity, that means whether she had a children or whether she wishes to have further children, and what sort of bleeding problem it is. And we try to find out the causes behind it. Now, first thing first is to check whether the uterus has got any problems, tumors like polyp, fibroids, or there is any associated problem of her endocrine disorders like thyroid, diabetes. So first thing is to find out the cause and try to eliminate the cause. Sometimes investigations in the form of hysteroscopy, endometrial sampling is required, but that is always followed before doing ultrasound, transvaginal ultrasound, that sort of non-invasive testing. Then the question of treatment comes. We need to decide whether it can be treated medically. Now with the latest advancement of medical management, we are fortunate to say that most of these hysterectomies caused by heavy period is now going to be reduced drastically. What we do is, we do a hysteroscopy checkup, which is a telescopy of the uterus. We take some samples. If we don't find out any tumor, we now have got an intrauterine device which is carrying some progesterone hormones which is liberated locally. Now this sort of intrauterine device is very helpful to reduce almost 75% of bleeding disorders not caused by any uterine tumor or other pathology. Now if somebody is not planning to have a child and is willing to wait and very keen on not having a hysterectomy, then what we do is we offer them this sort of management. Apart from intrauterine device, there are some medical management like tranexamic acid which can be used during the few days of heavy period and get a substantial relief. So the whole idea is to differentiate between the woman who needs an operation and where an operation can be saved. So don't get scared. If you are suffering with heavy period, menorrhagia or any abnormal bleeding pattern, please do consult one of us and we should be able to give you a relief without surgery. Take care.